Hi, Paul Silovsky here, physical therapist and owner of Rebound Physical Therapy. And today I want to talk to you about how hands-on treatment, or manual therapy as we call it, helps relieve chronic pain. You know, chronic pain is one of the most common reasons that patients come to see us at Rebound. And we often use manual therapy because A, it's very effective, and B, it actually really helps accelerate the healing process. Because look, either one of two things has to occur, and ideally you do both, is that you either need to get moving or be moved by you or someone else, like a physical therapist. And we're good at teaching you what movements to do on and for yourself, because ultimately you need to be able to do it on your own. But sometimes you need help, and manual therapy is super effective, proved in research. You know, manual therapy is a skilled application of manual pressure or motions, right, to help relieve chronic pain. In this instance is what I'm talking about now, but it's really addressing, soft tissues, meaning muscles, tendons, ligaments, and other soft tissues in your body that I won't get into describing in any great detail, but most people understand those things, along with mobilization of the joints themselves, okay? And you have these supporting structures with the muscles, tendons, and ligaments, but just joint motion itself and the other structures around the joint, of course, the nerves that interact with the muscles and are surrounding the joints as well. Proper application of manual techniques, the right force, the right direction, the right dosage, if you will, really accelerate the healing process in the body, because it impacts all those structures, right? The joints, the ligaments, the muscles, the tendons. Also, it gets the circulation going. It has a supportive effect to the function of the nerves because, as we've covered in previous videos, alignment and symmetry. If you're a little off with your joint alignment and structure, manual therapies can help get you back in alignment so that the nerves, muscles work better and you have better circulation. All these tissues and these structures working together are complemented by manual therapy. Let's just take a stiff joint for an example. When the body stiffens, whether it's over time or as a result of a protective mechanism from a recent injury, you oftentimes need help to calm the soft tissues down, the muscles and the tendons and sometimes the ligaments, to nurture them, if you will, where we're doing the moving so you can get motion back without angering the body and get things back into alignment, and also decrease muscular spasm. Manual therapy is really effective to calm the nervous system and the muscular system down in spasm, because we can hit some spots that you may not be able to get to on your own and gradiently move you through getting back faster and getting back in action, back in normal alignment and normal motions of the body. Because as you spasm and hold yourself to one side, oftentimes you need help to release what's tight and get you back in alignment and calm the body down. Just let the body do its normal healing process. We can just accelerate that alone. So listen, there's a lot of manual techniques. Sometimes we use, instruments, not just our hands, because our hands wear out too over time, but they're very effective for, getting the blood flow going. Actually feel wonderful. I've had some instruments used on me in manual therapy by some of our therapists post-surgically. I had some tissues that were really tight for a long time, had some surgery, my body's in a different alignment, and we had to release some tendons and connective tissue that really didn't want to be in that position. And it certainly, while I was a little sore for a few days, man, it really made a big difference, and it freed up my ability to move and be in normal alignment. And it created a situation where other tissues and structures, because this was in and around my knee, my hips and my low back felt better when I handled that area. So manual therapy helps in so many ways, and I think it feels awesome. I think it's great to have someone's help. We're here to do that, so give us a call. We can do an evaluation and tell you how manual therapy can help with your chronic pain. We look forward to seeing you soon.